Okay, so we've got a patient today who's a male. He's got an obvious hump over the bridge of the nose. The tip of the nose is a little droopy and it's poorly supported, and it's not, there's not much support to this nasal tip. It sort of drops a little bit. So the plan will be to try and lift the tip up a little bit, but not too much. In a male patient, we don't want to over rotate the tip because it can feminize the nose. We're going to take away some of the bump on the nose, but he's also got quite a deep area here, which is called the radix, which is a bit at the top of the nose here. We're just going to fill that in using a little bit of cartilage graft as well. So add a bit here, take a bit away here, lift, and just rotate the tip slightly. So the other thing he has is quite a significant deviation of his nose towards the right, towards his left-hand side. As you can see, it's sort of bending right across, and associated with that is internally the nasal septum is deviated as well. So we're going to straighten the nasal septum out, both from a breathing point of view, but also to help facilitate getting the nose much straighter. Okay, so what we've done with this gentleman is lifted his tip up. It's slightly higher than it's going to be. It's always a little bit higher. Number one, because he's lying a bit flat, and number two, because the tip always drops down a little bit with time. But we've lifted his tip up. We've taken away the bump, and we've given him a little bit of an additional graft in the great radix area to make the nose look straight. So you'll end up with a straight looking nose, particularly when the tip comes down to about there. It'll drop down a few millimeters, as I say, both with gravity and with time. And what you can see from the top is the whole bridge of the nose is very much straighter. He's got a little bit of tip definition. He's got quite thick skin, so again, a little bit of tip definition will help him. And the nose is very much straighter. We've also straightened out the really significant septal deviation that he had from inside. So overall, I think this is a very nice result. I think he'll do very well from it. We've got the nose straighter, we've got the nose nicer from the profile view, and we've lifted the tip up and given it a bit of support.